This conference will now be recorded.
Good morning, Leslie. Okay. If you want continuing education credit for this class, you must attend the entire webinar, and you must identify yourself at the beginning, so everybody does have their name out there. So we're all set to go on that. If more than one person is taking it from your location, we need to know who everybody is if they all want credit. Uh, you must send an email to Irene over at Bakersfield ARC if you want the credit, and in there you must include three things that were important to you today that you learned from the seminar or that were review that so that we know that you did actually learn something from what we did today. And we ask that you send in your credit request within 30 days, so that way we can keep track of all of that, because we have an obligation to both Kern Regional Center and to community care licensing in regards to the CEUs. And so we want to make sure that we are doing it consistent with the expectation that those agencies have for continuing education. Okay, any questions on that? Okay, well, let's move right into it then. Okay, today we're going to talk about person-centered planning, and this is basically for some of you this may be a review, for some of you this may be new. As you may or may not know, effective January 1, the state of California, the Department of Developmental Services, has developed a new protocol for IPPs that
Jeff,
will
you're
be
having a little
completed
bit
by
of connection
all service
issues.
coordinators throughout the state.
I don't know if you can hear me. Maybe turn off your camera. See if it reconnects better.
Jeff, if you're talking, we cannot hear you, and you look like you're frozen.
If we end up losing him, he'll log back on.
Let's see what I can do here. Dan, can you get this?
I can hear you now.
Hang on 1 minute. Can you hear me now?
Yes, we can hear you.
Okay,
Just
good.
try it. Just try it
And
without
can
the
you see
camera
my
on.
slides?
Cannot see the slides now. Just leave your camera off and then share your screen. Should work like that.
Okay. Yeah, I
There
turned
you
my,
go.
so let me turn my camera off so that that way we won't. Yeah.
All right, I see slides now.
Okay.
Try that again.
Now it's on, right?
Correct. Yes.
Okay, sorry about that. It seems like it's working now. Okay, so today we're going to be talking about person-centered planning. As I started saying, for some of you this may be a review, so for some of you this will be new material. As of the 1st of January, all new IPPs, so anybody who has a January birth month of 2025 or beyond, will be getting the new format. The new format is person-centered planning. It is something that really there's not a lot of ability to deviate from. It's sort of got topics, and then you sort of fill them in as you go along. And it really does a much better job of focusing the meeting in the direction of person-centered planning. But what really is person-centered planning? That's the question. A lot of different people use the terminology, but what does it really mean? Well, first of all, first and foremost, it's respecting the individual. In the past, oftentimes we would make plans for somebody with them sitting there and maybe asking for their input, maybe not asking for the input, maybe at the very end of the meeting after we have, the day program, the residential program, and the regional center staff, and maybe family if they're involved. Have all sort of decided on the goals for the person. They just turn to the person and say, "Is that okay with you?" And that was the nature of the plan. I remember years ago sitting in a plan one day, and they were talking about the person's personal hygiene and all the challenges that were occurring and the assistance they needed with bathing, grooming, and dressing and toileting. And they were talking about the person in third person. He does this. Jimmy does that. No one looked to the individual. No one talked to the individual, and so the plan was being made about that person without that person being there. And um, I've seen situations where individuals didn't want to go to their meeting, and if you sat there and talked to them and asked them, well, why is it that you don't want to attend the IPP meeting? Uh, they might say, well, because people talk about me, or they say things about me, or I don't like that. What's going on there? And it really wasn't focused about the individual. So that's where the idea of respecting the individual, trying to understand what their point of view is, and then listening to them and really feeling what they have to say, and sort of trying to get into their view of the world, and trying to write the plan respectful of that and accordingly. The person centered on the individual's interests, capacities, and dreams. So it takes on a different sort of perspective. We're going to talk about this some more throughout the morning than what is historical. When I first started working in the system back in the 1970s, uh, we did a problem oriented record where we focused on what was the person's problem. And so, a problem might be a person needed a place to live. Well, the solution and how we would address that would be put them in a board and care facility. The person needed something to do during the day. So the goal was to get them into a program. And so it was very, what's wrong? How do we fix it? And it was more of almost like a medical model where you go in and you have an illness and the doctor prescribes a medication or a treatment, and then hopefully you would get better. And that was sort of the idea behind that problem-oriented record. There's a problem, and then your orientation was predicated on that problem, and that you created the record that where you would address uh, what you were going to do, and you did one of three things. You did either you were going to address the problem, make it better. You were going to stabilize the person so that there was an issue, and we weren't going to make it go away, but we were going to sort of make it so it wasn't going to get any worse. Or the final one was we were going to prevent deterioration, so that we were doing something so that the individual wouldn't be moving in the wrong direction, that the behavior wouldn't be getting worse, their health condition wasn't deteriorating, their housing, was stable, etc. So it really changed over time in terms of the focus at the meeting. And then came 1978, we went to individual program plans, the IPP. That was a brand new, very innovative approach to it. But what you ended up seeing, at least initially and for I think many years after, was it was just now sort of a change in the wording, but was basically still along the same idea, where although the plan was supposed to be individualized to the person, it still read in many cases, Susie needs something to do during the day. Uh, she's going to go to the ABC Adult Day Activity Center. And so you were still basically looking at what was the in quotes problem or the issue, and you were doing that so that the services and supports that were being written into the plan, and they were either then being purchased through regional center purchase of service dollars, sometimes through generic resources, health insurance being provided by the schools, being provided by county behavioral health, et cetera, would all be then flow from the plan that we were writing for that individual based off of their needs. But again, who was making the decisions about those needs? Were they the folks sitting around the table? So you had the regional center service coordinator, the day program provider, the residential provider, the maybe the families or somebody else in that person's life, and how much of it really was the individual themselves saying, this is what I want to do with my day, this is where I want to live, this is how I want to utilize the community. So much of that was being done for the person. And matter of fact, in many cases, the programs would come in, the day program, the residential provider would come in, and they would have a whole set of goals and objectives for the individual. Okay, here at the ABC Day program, from 8 to 9, when the clients first came in, we work on hygiene because they're just coming into the program in the morning. It's a good time to make sure that everybody's gets their teeth brushed and their hair combed, and and they're dressed appropriately for the day, et cetera, et cetera. Then from 10 to 11, we'll do this, and then from 11 to 12, we'll do, and they had a whole series of events or tasks or places they would go that were pre-planned. And so that if you came into that program, you were sort of told, okay, this is a schedule that you'll be following as an individual who is attending the ABC program. This is, for the group that you're in, and sometimes those groups were developed based off of the amount of supervision that individuals needed. So, many programs are, 1 to 6, 1 to 4, 1 to 3, depending on the vendorization and the service needs of the individual. But the program itself was developed by the day program. Same thing with residential services, that somebody would go home in the evening, and what was planned for their afternoon and evening and weekends was done almost exclusively by the home staff, the direct support professionals, the facility administrator, et cetera, and that the individual themselves had very little input into what was going on with their planning. Person-centered planning now changes that. We're still talking about individual planning, which goes back to 1978. We're still writing an individual program plan. That hasn't changed. But what we're doing now is we're saying, okay, the focus of that plan is really, what does that person want? What are their interests? What are their abilities? And what are their dreams? So we're trying to change the focus. We're in the old days, much of the plan was written around deficits. And interesting enough, the home and community-based waiver program still requires that a client have a certain level of deficit in order to be eligible to be in home and community-based waivers. So there's still some model out there that looks at what's wrong with an individual, and or what their needs are. Wrong is sort of old think, but what their service and support needs are. If individuals didn't have service and support needs, they wouldn't be in the developmental services system. The system is predicated on the fact that people need the assistance of a coordinator to coordinate their plan, community services and supports to implement that plan, and to really make it so that people have greater community independence, have more ability to uh, maximize their potential. Um, um, One of the things that we also want to really try to do when we do person-centered planning is that we want to try to use everyday language instead of technical jargon, including language that is understood. So when we're talking with uh, the individual whose plan it is, uh, using language that is understandable to them, using examples and you know bringing it to a level that that individual uh, should understand, and that also includes language too. So if someone doesn't use English as their primary language or uses adaptive skills such as sign or other forms of communication, are we doing the plan in a way that they really understand what's occurring at the table, and not only understand what we're talking about, but also listening to what they have to say and trying to, if we don't understand it, either because uh, it doesn't seem to make sense to us, or maybe the person's articulation is somewhat hard to understand. What are we doing to sort of take a step back and really asking it again? Maybe there's someone in that person's circle of supports who's really good at understanding their communication, and are we really asking them for help at the person's request? So they need the individual themselves needs to ask for that additional support. And if they do, and if that person is able to, then share what they think that that individual is communicating, then checking it out with the individual to make sure, yes, indeed, is that now what Mary said, is that right? And then hopefully the individual will be able to acknowledge that that's indeed how they're communicating. So communication is very important, and we want to be at a level that's very understandable to the individual because it's their plan, and we want to make sure that we're doing it according to what they would like. And one of the big differences that you see in person-centered thinking from the plans of the past. So we're the IPP of the early 80s, 90s, and 2000s versus today is the plan considers how to address the need for relationships and community connections. So, one of the uh, basic tenets to home and community-based waiver is that people are part of communities, and that we really try to integrate individuals so that they don't spend their entire time out and about, or even in their residential setting, with people who are paid to be with them, or other individuals who are also in the regional center system. But in doing that, there are different levels. Some people would like a lot of community, and our goals are to really try to, maximize the amount of time that they are involved with different activities, part of social groupings, trying to get them fully integrated in the community. Other individuals may be much more introverted and really, for whatever reason, don't really want to have a great deal of community integration, and we want to be respectful of that as well. So it's a balance to make sure, but we really want to address community relationships and connections in the process of writing a person-centered plan. Um, I was just talking to my colleagues over at Bakersfield ARC the other day, and they have now have a pretty robust social recreational program. And they shared with me about one individual who got signed up for it. They went to talk to this individual. They were at first very reluctant to want to do anything and or to get involved with any of the activities. The person then got involved with one or two activities, and now the issue is that the purchase of service is for a finite number of hours of social recreation every month, and this individual is using them up early in the month and wants to have more, and so they need to go back to their coordinator and look at their plan to see if it's fully addressing that need. But that was really a change over having that exposure, having that opportunity, and given the ability to integrate and be involved in the community really made a difference, because once that person got over the initial shyness, the fear, could be previous experiences which weren't positive. We don't really necessarily know what it is that was holding this individual back. But once we were able to address some of that, it really made a huge difference, and the person became very much uh, community grounded. And so, something to keep in mind when you're developing these plans: start with where the person is. How much are they saying they want to be fully integrated? How much do they want to be involved with activities in the community? How much are they much more sedentary? So some individuals who are on the autism spectrum may have issues around others, and we want to be respectful of that and try to work from where that individual is and how much community we really are encouraging and supporting in terms of the services and planning that we're doing for that individual. Um, this way is different from outdated system-driven plans. PCPs emphasize the person's unique needs and aspirations. And again, as I mentioned earlier, um, the day services, especially, were very curriculum based, and it was actually encouraged in many ways, because if you look at the program design that historically was written consistent with Title 17 of the California Administrative Code, it was define your curriculum, and your schedule for the day was part of the program design that you had to submit to the regional center. So programs would feel like, okay, wait a minute, we have to very much comply with this program day, because if the regional center or DDS auditors were to come out and take a look at our program, and it said from 11 to 12 that was a exercise class, and we were going out into the community to a store to talk with the manager about employment opportunities and what that store its expectation is for someone who is a clerk working on stocking shelves. So if we were doing that during the 11 to 12 hour versus the exercise program, would we be in trouble with our vendorization? So hopefully that's changed. The DDS, licensing, other agencies are really looking at now where the regulations of the past are sometimes in conflict with the new direction of services, so that as we talk about greater choice and the individual making their own determination about their day, uh, that schedule that says that from this time to this time, everybody in this group is doing this, will sort of be left behind, and we'll now be looking at, okay, how do we create like groupings within the day activity that are doing different things consistent with what people's hopes and dreams are, what their desires are, what their capacities are, and that's fluid and changing, and it's not a rigid time frame of when we do a particular activity on a given day. The analogy that one of my colleagues used a number of years ago, he said, when the program comes in and tells the team what they're going to do for that individual during the day programming hours, that's kind of like the tail wagging the dog. That you have the service provider saying what service they're going to give, not the individual saying, this is the service I want from the program. So we really want to try to make sure that we're emphasizing two things here. One is we're just saying to the individual, hey, you tell us what you would like during the day or in your residential setting. And two, hey, you as the residential provider, the day service provider, are respectful of what that individual is requesting and are going to develop their program consistent with what they would like. So it's not about what your facility would like or what is the most convenient for you. It's what the individual like. This is really, I believe, the biggest challenge for you as providers, in that the resources are limited. If you're if you're vendored at a 1-to-6 ratio, so you've got 6 individuals, and each one has an individualized plan, and what people are wanting during that hour or during that day or in the evening or on weekends or whatever the setting is, and what you're able to do with the staffing that you have can really be a challenge. And this is where creativity comes into play, and where we as providers need to spend more time together. It's one of the things that I've really wanted to do with community of practice, is look at ways that we can share with each other ideas and things that have been successful in working with a multiplicity of demands, of different individuals wanting different things, being respectful of everyone's individual plan in a sort of group setting. And that continues to be a challenge. And, I don't see more funding coming down the pike anytime soon. Just California has budget restraints. There's a new administration about ready to take office in Washington, D.C., which is talking about cutting back on some of the services that have historically been provided, et cetera. So it we're going to need to continue to be more creative with limited or even more limited resources in the future. So this really becomes a challenge: is how do we go from that outdated way of doing things, but it worked. I mean, because we had everybody together in a setting, and we were able to manage it and live within our means and take care of everybody's day. But we really weren't doing it in a way that was individual to that person's desires. Um, okay, PCP is a practice that is used with people of all ages, abilities, and circumstances. It works for individuals with IDD. So if you actually Google person-centered planning, what you'll find is that they talk about it for utilizing it with elderly individuals who are involved with long-term care or have other support needs, healthcare needs. Uh, the mental health system, behavioral health, is now embracing this model. We're seeing it more in the child foster care system, in other systems. So this is a model which is really, at this point in time, the future of social services, that for those systems that require services being implemented predicated on uh, planning with that person in mind, and that person as being the linchpin of how that plan is developed, is pretty much the best practice throughout almost all social services now. So if you at all are working with other agencies or part of a team that is multidisciplinary, so that if an individual is receiving services from, let's say, behavioral health as well as from regional center, and you're having a multidisciplinary meeting of the different agencies, the mental health folks will also be talking in regards to a person-centered approach to the services that they will be providing, as well as the regional center talking in a person-centered approach to the service model. It is a way to assist people who need home and community-based waiver services to share and describe what they want and need to bring purpose to their life. So, okay, as we've talked about before, the home and community-based waivers service system sort of derived from uh, the old model, which again, if we're talking about what history, that for many years the federal dollars went to the institution, so that if someone were to be placed in, we used to call them state hospitals, and then they became developmental centers, that the dollars would flow, so that the money would go, so the federal government would support California for those folks that were in, let's say, for example, Porterville Developmental Center. I knew it as Porterville State Hospital many years ago. And there wasn't a whole lot of money flowing into the community. Well, the whole idea behind the home and community-based waiver was to sort of flip that, so that the federal dollars would come now to the community rather than to the institution. And initially, when that program first started, the dollars were very limited, and the level of, in quotes, deficit that you had to establish was such that this individual would be, let's see, yeah, mental health does have home and community-based waiver services. Um, they're getting dollars that way too. It isn't exactly the same as the way the regional center system is, but California has a number of home and community-based waiver um, services systems. There's one for HIV/AIDS. There's one for elderly. There's one for mental health. There's one for DD. So I think altogether there's 7 different programs that fall under waiver within California. Um, so anyways, the dollars have shifted, and now if you were to look at where the money comes in, it's almost 90 cents on a dollar of the federal money is going to the community, and only about 10 cents on a dollar is going into institutional care for persons with developmental disabilities. The challenge to that with, as I was mentioning earlier, the change in the new administration, and I don't want to get political here because I don't think that's a good thing to do because everybody has their own opinion. But one of the ideas that's being floated by some of high-ranking Republicans is to put the Medicaid system on what's called a block grant. A block grant is a block of money that's sent out to each state. And the advantage of that type of system is then the cost to the federal government is fixed. So you say, okay, here, California, here's, let's just say, here's $5 billion for your Medicaid waiver program system. And then if what California finds is that to fully implement all of the services, it costs closer to $6 billion, then California would have to eat that difference or would have to then start limiting services. Right now we have the entitlement, but the entitlement is by legislation. So the legislature at some point might have to go back and take a look at whether we can continue to support that. So that's the potential downside. If California could, so it says, okay, we get 5 billion and we're only going to spend 4.7, then everything's fine. So we don't really know, and none of us have a crystal ball. But the potential, if the federal government decides, and that would have to be done legislatively. And at this point, it's just a proposal. But what I've been reading is that some advocates, some people who advocate for the system, are concerned that that is a potential downside to block grant. But if the bigger issue is fiscal accountability, there are certain advantages to that. So that's for politicians to decide. Not, unfortunately, we don't, or fortunately, we don't make those decisions in terms of how the money comes to California and subsequently how it's then distributed within the system. But that may be changing in the future, and it could potentially have some impacts on our system. And there are some individuals out there who are predicting that it may have a negative impact. I don't really know. I'm not going to second guess one way or the other. We're not there yet, and if we do get there, one of the things that I've noticed over the years is that the system is very creative at figuring out how to make things work, even in times that are a little bit uh, more austere. And so, I'm continuing to be optimistic that the system will be, that the home and community-based waiver system will really continue to provide positive opportunities and will be a way to move forward with the system that we operate. Unlike other planning methods, person-centered planning emphasizes the individual's interest, strengths, and what they want to do. It shifts away from just speaking to the needs or limitations. So, as I was mentioning earlier, plans used to be about, okay, what does this person need? And when we talk about what they need, who made that decision about what they need? Was it the staff who were saying, Jim can't do this, or he could be better at that, or this is not a skill that he has, and we think that he could develop that skill? Or is it something that Jim said, hey, I'd like to be able to be more involved with a social group. I am not really good at talking with people, and I really don't know how to get involved, and what have you. So is it him saying that, or is it the staff coming into the meeting saying, well, Jim's a loner and we need to really work on communication and getting him to do that, and eye contact, and and then come up with a list of skills related to social integration that may or may not be of any interest to Jim. So that's what we want to avoid, and we want to really look to strengths as well. I've shared the story before about you find an individual who they we're all sitting around the table scratching our heads saying, well, what can we really do with this person? And then you find a job, a hobby, an activity that that person really enjoys. And then sometimes it then becomes, wait a minute, how do we move this person onto other activities or other skill development or other parts of their plan during the day, because that all they really want to be working on most of the day is that one thing that they really want to focus on, and that is a really strong skill for that individual. And then we also want to look at other things in their day as well and really work with them on that. So it really, again, finding that. And personally, I've been in this business for 40 plus years, and sometimes I'm very good at figuring out what someone's interests are and strengths, and other times it's more of a challenge. And that's really why you really want to spend some time. And one of the concerns that I currently have is that in many cases, the high turnover in service coordination and at the regional center level, and the high turnover of direct support professionals at the day program residential level sort of work against this, in that to know what someone's individual interests and strengths are requires getting to know them. And, and if you're brand new to that individual, so you really haven't had a good chance to understand them or get to know them or find out what they really like, and then you're going into the plan meeting, it limits some of your ability to really help that person address what they want. And so it does become easier to look at sometimes what the needs and limitations are, because those are very obvious in most cases. The strengths are sometimes a little bit more of a challenge to figure out and develop. Um, a person-centered service plan must reflect the identified through appraisals of need. So we're looking at the person. We're helping that person figuring out what it is. It doesn't have to be a formal assessment. Just talking with them and finding out what they really would like to do, what their need for support is, and what they want that support to be. Um, and as well as what the individual wants with regards to developing such services and supports. So again, the whole idea being where is the supports that work for this individual. And
Jeff, I think you're having some connection issues again.
um, um, the goal of developing services. How about now? Is that better? No.
I can hear you now. You were cutting out a second
That
ago.
is better now.
Yeah.
Okay, good. Yeah, I can say it was spinning there for a minute. Thank you. Um, I I have a good, robust internet service, but sometimes it just does strange things to. I think there may be some ghosts in my house. I don't know. The goal of developing services and supports that are person-centered is empowering individuals to shape the lives they choose and want at any age across the lifetime. So, now think about this. Have you ever been on a job where you get called into the office and they say, okay, you're not working up to, you know, full expectations of the company, and we're going to put you on a support plan, and we're going to evaluate you over the next 3, 6, uh, 12 months. And if you don't make it, you're out, I mean, and the amount of pressure that puts you under in the matter of the, and how you're then, sort of concerned about every uh, thing that you do within that workday. That's not the direction that we want to go. We want to look at, okay, so what are positive things that we can focus on for this individual? What are uh, strength-based services and supports? What are activities that we can do? Um, you know, I've done some consulting with families who have children with attention deficit. And one of the things that you find, I sometimes tell people to take like a golf counter or some other sort of thing, that device, and count the number of times they say something positive to that individual. Sometimes something that they say that's a correction to that individual. And families are just astounded by how much they are correcting the individual over how little that they're praising that individual. And the same sort of thing goes on here. We want the plan and the implement, and that was great. You did a wonderful job. That's we really appreciate that. That activity that you're involved with is just you're doing such a direction. And look at where you were, 4 months ago. Look where you are today. Really helping people to see times.
Jeff, you're having issues again.
The goals of developing services and supports that are person-centered is to empower the individual. That's okay. How about now? Can you hear me now?
Yeah, we can hear you.
Okay, how about now? Okay,
Yes.
I have no idea why it's doing that. The practice involves fashioning a, okay, so I am good now. Hello?
Yeah, you should be good.
Okay, the practice involves fashioning a vision of the future and identifying what it takes to work towards that vision. So if the person says, this is where I want to go, that I would like to have a community job. I would like to be in my own apartment. I would like, to be involved with the choir at church. How do we go about moving that person towards that vision? It's not about fitting into the system. It's about creating a plan that truly reflects the person. So, it's, as I mentioned earlier, it's not about 10 o'clock is this class, 11 o'clock is this class. It's about, okay, what do you want? Did you even want this class? And then moving in that direction. Okay, and then the planning group, often called Circle of Supports, includes those who know the person best and are dedicated to exploring options together. So we want to have a team that is people who really know that person and are dedicated to what's in that person's best interest, not in what's in the best interest of the program. So it's not about what the needs of the day program, or it's not about the needs of the residential services program. It's about the needs of the individual. Okay, that's my last slide. I got about 10 minutes. Hopefully this was thought provoking. Any comments, questions, concerns?
So Jeff, I just dropped in the chat a resource. I don't know if everybody is able to see the chat feature on this website, but going in line with your presentation on person-centered planning, DDS did release a guide, kind of like a pre-IPP guide for individuals and families and even providers to use prior to having those new IPP meetings that are coming up starting January. So
Uh,
it gives, it's a great tool and it helps develop those conversations about what's important to the individual, for the individual, how they make decisions. And it dives into all the areas of person-centered planning that could really help our vendors as well to have these conversations prior to those meetings to
yeah.
have a really robust opportunity to plan.
Thank you, Leslie. Yeah, that is, it's a great tool. I've looked at it. Matter of fact, I've used it a little bit in some of my presentations. It if you as a program provider are sending someone from your staff to that IPP meeting, I would strongly encourage you or that person that you're sending to read this, and so they get to know it, and then uh, once you get to know it, to start implementing it with the individual. The biggest challenge is if you really work with that document and do it right, and then you go into a meeting and that meeting is an hour, you're not really going to do it justice. That a good person-centered plan is takes you know more time, but unfortunately, the way our system is funded, and again, it comes down to a matter of funding, the amount of time that's allocated for a IPP is somewhat limited, and it doesn't necessarily allow enough time to do a complete and thorough plan that really addresses all of the hopes and dreams of an individual. But that's a great start. I really, really appreciate you sharing that resource, Leslie. Um, Other questions or concerns? Okay, well, thank you for your time today, and we'll hope to see you, some of you, next week on the call, and I'll work with my technical advisor and see if we can try to get rid of these webinar glitches. Thank you, Nal. Have a good day. Bye-bye.
Thank you, Jeff.